everybody. My name is Joyce Gibb. Today I want to talk to you about the risk of proton pump inhibitors and the risk of increase with dementia, of using those medications. So there was a huge study. This was in Germany, and they had several thousand people, 73,679 people that were 75 and older, and they were actually, the average age was 83 years of age. So they took, that was one study. They were free of dementia according to the ICD-10 codes, which in the US that's what they are, but in Germany they were codes used for dementia as part of the insurance agency, as they just went back and reviewed all those studies. And then the 77.9% of those people were female, and so a lesser extent they were male. And then the other arm of the study were people that had started on a proton pump inhibitor, and those actually they just decrease the acid production in your stomach. Now you need acid to digest your food, and as we age we normally make less of that to begin with. So the drawback of this is you can't digest your food, and through the Bredesen protocol they always recommend no PBIS and no statins for trying to decrease your risk of dementia. So, and I was like, where did that study come from? So I just want to look it up, and it's from a huge study, and they adjusted the confounding factors for age, sex, comorbidities, which are multiple other things like diabetes, heart disease, and things like that, and polypharmacy. So those people that previously had all those things were taken out of the study. So one of the things, it was, like I said, a German health study, and the main outcomes show that the association between using a PPI, and they showed the ones they studied were omeprazole, pantoprazole, lansoprazole, esomeprazole, and one thing that we don't have, I think, is rababrazole, something like that. So, but those drugs are in Europe. They're also in the United States. So people that use those drugs, and it could have been any of those, the association between PPI use and dementia was analyzed during this study. So the model was adjusted for those confounding factors. And so the one thing that they found was that patients using PPIs has a significantly increased risk of dementia. And so when looking this up, I kind of found, some other things. They were saying, well, that doesn't always happen because, there's other studies that are necessary. And but the one thing that came through, and the average age was 83 years, 77.9% were female, and they had a significantly increased risk of incident dementia compared to no proton pump inhibitor risk. So I think, you have to talk to this with your doctor. You have to make some of these difficult decisions with your doctor, and, just kind of think about, as you age specifically, if you have risk of dementia in your family, if your family has the ApoE4 gene, definitely if you have that gene, which is the Alzheimer's gene, then really think about what you should be doing with PPI use. So I would say, just think about what you need to do and do the right thing. All right. Thanks for watching. If this information was helpful, hit that thumbs up button down below. If you want more videos like this, hit the subscribe button down below, then ring the bell next to it. Also, if you know other people that you would want to share this link with, please do so, because I would love to help them on their journey to good health.